second shot right off the bat. I don't think it makes sense. At 7:35, let's move on in the KUAM News Zoom room where the acting public health officer, Mr. Chima Mbakwem, is standing by. Chima, of course, anytime we see those big positives, whether they're on a Monday where you guys kind of accumulate and report out all the tests done over the weekend, which we had, I think, 17 on Monday, right? And then 20 yesterday. That's pretty big numbers, man.
Yeah, but these are more like family exposure, so it's not like too much worry for now because all of them were through case investigation. So we had index cases. The team went out and conducted interviews, were able to identify their contacts, and then they were tested and they were all positive. So I think we don't really have to lose too much sleep because it's contained now.
Sounds like you lost a lot of sleep, though, tracking this down.
Yeah, yeah. This past week has been pretty tough. You know, the new guidance and the AV&V, and then these 20 cases that I have to make sure that is well investigated, so that people would be rest assured that you know, as we're opening up, you know, we're still safe.
So let's get into the details. You say these, so the 20 and the 17, can you give us the specifics when you talk about family exposure?
So these are household exposures where, you know, the index case is a family member, and then we identify. So basically what we do is, like I always explain, we use the concentric circle to do our case investigations. So you're looking at people within the closest proximity of the index case. So mostly is the family or the co-workers of that individual before you start looking into the community. So for these cases, these are like 4 families where these cases were identified and they were all tested and they were all positive. But I think the interesting fact is that for the initial case that we had, the 20, out of 18 of them, 15 had no vaccines, and 3 of them were not eligible for vaccine. So you can see that the concentration is on people who are unvaccinated. You know, so this is a family unit these are family units that are not vaccinated. So they are, and with the reduction and restrictions, you're seeing that people are getting more relaxed within the family and they're infecting themselves. So it's just for us to keep pushing the message, you know, for people to go get vaccinated. And when you get vaccinated and enter the draws, you're going to win something too. So it's a win-win situation for them. So,
yeah. So let's rewind. So we had 20 positives, 17 positives. How many of those 37 cases were individuals who were not vaccinated at all?
For the initial 20, like I mentioned, 15 were unvaccinated, 3 were not eligible for vaccination.
Why?
Yes. So that is for the 20. For the other 17 you're talking about, I don't have the vaccine information. I'm still waiting for them to send out the information to me this morning.
How sick were these positives?
All asymptomatic. And that is the danger, you know, because now, even when you do the temperature checks, when you're going into buildings, you seem to understand that you can't even detect these people who are positive. So it is a huge balance between, you know, personal responsibility, you know, you wearing your mask to protect yourself, as against hoping that the temperature checks at the door would catch someone who is sick. But at this point, we're seeing more asymptomatic people walking around with the virus. So I think the intervention, the using the mask as a form of intervention still goes a long way, to protect you as an individual. So even when, there's a recommendation for people who are vaccinated to stop using masks, when they are outside and when they're with people, I think some people can still look beyond that and understand that, as a form of, you taking care of yourself. Wearing a mask can actually protect you from people around you who might be sick, do not have symptoms, and can still transmit the virus. And then being unvaccinated also becomes another challenge for those who are not wearing their mask and also hanging around people who might be potential, who might have the potential to expose them to the virus.
Why were the 3 not eligible for the vaccine?
They are kids.
Okay. So they're under 5.
Yeah, they're kids.
Right on. What about cases caught in quarantine?
Yeah, there were 6 cases in the quarantine, yes. For the quarantine cases, there were 6 quarantine cases, and with the preliminary test, we tested 57 individuals. 6 of them turned positive. So I'm still waiting for that same information, because what happens is that when we have these cases, the case investigators will do a secondary interview to gather information that these people most times do not put on the lab sheet. So when the information is not readily available, that means the individuals did not provide that information. So.
What else is going on? We had a question here, Chima. How soon will vaccination be available to all school-age children?
How soon?
Yeah.
Vaccination, school-age children. I don't understand the question.
So what age are we?
We have vaccines for school-age children, but within a certain age. So are they asking for kindergarten or something? I don't know.
Yeah. So you have no idea. What about the booster shots? Are we starting to think about that effort and what it's going to entail?
I mean, like I mentioned last time, I think these are assumptions, that, over time, like every virus, there are limitations, new sciences for how to combat new strains, like the new strains that we have. But right now, I don't have any information about the booster shots, and I can't make up stuff. There might be speculations, but there's nothing concrete, or definite for now about booster shots. But let's focus on getting people vaccinated with the ones we have now before we start thinking about booster shots.
Right.
Let's get the initial protection here before we start boosting it.
Right, Chima. So as the chief public health officer, when you come across these cases and you're finding like whole families that aren't getting the vaccine, what does that say to you?
So something about people that we need to understand is that everybody has a different perception of their health culture, right? So you're looking at people who have different understanding of how to protect themselves. So for vaccines are to prevent you from getting sick, right? So some people don't see the reason why they should go to the hospital when they are not sick. So it's up to you. It's up to us as public health, to put the messaging out there, which we are doing, to make people understand that preventive health is the way to go. You don't have to wait until you get sick for you to go see a doctor. So that's why we want you to eat healthy. We want you to run so that you lose weight. We don't want you to get into having chronic diseases. So that perception is about people and their health culture. So you see people who are into preventive health, they go for their regular checkups, they take their vitamins, they go out to run, and then you see another group of people who just don't care until they're almost about to drop dead. That's when they go to the ER. They don't even see their primary physician, and then you end up seeing them dead or, chronically ill, because at the stage when they go to seek care, it's too late. So that's the balance. We see that in different ethnicities, and we as public health, we have other approaches and other strategies to try and encourage people to go get checked, before it's too late. So it's nothing new, it's prevalent everywhere in the world. People are writing to us, asking for exemption from vaccine, and when you read most of them, some of them are genuine, people are sick, medically they cannot get the vaccine. Then some people are coming up with stories, that really touch the heart, telling you how, they feel that, there's no COVID and they're healthy, they can't get sick, What do? You can't force them, you try to reason with them to go get vaccinated.
Right.
So these are individual choices, but you guys, I can see you do a lot. The government is doing their own part. Other sectors are trying to encourage, people, to go get vaccinated. That's the most we can do. But if you don't get vaccinated and you get sick, the outcome might not be favorable. This idea of being a Superman because you're young or because you feel you're healthy, is something that we just need to walk around, and make people understand that vaccine preventable diseases can actually be prevented by those vaccines. But like I said, they're personal choices. So.
Right. So how big do you think that segment of the community is? Because we're pulling out all the stops. We're giving away $10,000 cash. We're giving away a car every week. Yet we're still having these whole families who are just like, we're good. We don't need the vaccine.
Sometimes something just have to happen to you, for you to have a change of heart, So I think some people are very strong in their belief, and some people are also adamant, and then some people actually lack real information. Some people need more information. Some people need more, encouragement. It's a mixture of several factors, but I'm optimistic that the way we're going before Liberation Day, we will be in a very comfortable place. And these other people that are not vaccinated, the ones that are vaccinated will be protected against, whatever these ones are going to give to us. And then when you wear your mask and keep away from, from people that, that are not your close family members, and try to watch your distance and wash your hands, I think we'll be in a safe place.
Hey Chima, what's the policy on the temperature checks? Is every business mandated to have a temperature check thermometer, or is just the sanitizer okay?
Yeah, I think that is a question for the environmental health division. They're the ones handling that. But it's highly encouraged,
that's it. It's highly encouraged, but not mandated.
Highly encouraged, yeah. But like I said, these are strategies. I said, if you don't have symptoms, you won't have a temperature. So when you check your temperature, and you don't detect anything, and you're wearing a mask. So these are there are different strategies, to reduce the spread. So one works with the other. So we can't eliminate temperature checks because we can still get people from there, So.
Right. I just trip when I walk into a business and they don't have a temperature check machine, and what they do have is a big bottle of hand sanitizer nailed to a 2x4.
And that works too if you're wearing your mask.
I'm like, okay, but I don't like touching the sanitizer because everyone's touched it, and it kind of defeats the purpose. You know what I mean? Yeah. Okay, Jay, go ahead.
Okay. Yeah. Hey, Chima, it's Jason. Just real quick, I was curious. When I know when you and your team, obviously, you guys are coming at this from the standpoint of science. But have there been any surveys where people or families have said, I'm choosing not to get the vaccine either because of philosophical or religious reasons, just maybe as you said, maybe my own personal beliefs don't permit me and my family to receive the virus or the vaccine.
Yeah, we see that every day. On my desk, I have a few that I have to initial offer,
Is it a fairly large number?
Not as large enough to create concern, but enough for you to ask, like when you're reading the content, that is what really, like people's reasons, sometimes the reasons might appeal to your conscience, when people are telling you, I take good care of my kids, I do X, Y, Z, so I don't see the reason why, so, like it's their opinion, as against, what is out there. But we see them, we try to handle them to the best of our ability. And also know that this is not just for COVID alone, it's basically across all vaccine preventable diseases.
Yeah, John Fernandez, of course, the superintendent of the Department of Education, was even saying that, he goes, we are already anticipating, and we've seen a lot of people that just said, maybe parents would say, either because of our beliefs or our stance, we decide what's right for this family, one way or the other. So our children are going to have to, it funnels down to them. So, they're going to have to make accommodations for that when the school year resumes.
But to be fair, I mean, I don't even think it has to be about somebody's beliefs per se. I mean, some people, just looking at the black and white of it, I mean, they whipped up this vaccine. It is an emergency use approval. You know what I mean? So, I mean, those two facts alone would consider, I mean, maybe a rational person would be like, oh, maybe I'll just wait. So that doesn't necessarily mean they're crazy.
But see, religion is kind of religion's a different topic though, because like, you may even want to receive it, and you can say, I know this is right. It's just, my beliefs won't permit.
But I mean, if and this is not a rational time because it's a pandemic, right? And we lost so many people, so it's a different set of circumstances. But some people just don't want to take it just based on that alone, and I can respect that. Mm-hmm. I can, because you're right. It's up to you.
The challenge here is that, when you look for the negatives, you see the negatives. You know what I mean? Yeah. When you spend your time, if you type "can vaccine kills," you're going to see it on the internet. Because there are people out there putting stuff up there, If you type "can vaccine save," you will see stuff, So it's what you're looking for, like even the Bible says it, like those who seek, if you seek, you find, When you look for something, you find it. People take their time to look for stuff, People look for facts, to substantiate whatever their beliefs are, be it traditional, religious, personal, But
so confirmation bias, basically. Yeah.
Yes. Yeah. But for us as public health, we understand all this, and then we try to strike a balance. So if you're in a situation where in a room you have 80% of the room vaccinated, right? The 20%, we can say, okay, for this 20% to be part of this group, we need to be having a surveillance on this number of people. So every week we can do a random testing, because at that point they are the ones who pose a danger to the 80, So we accept the fact that you don't want to get vaccinated, but we need to, keep an eye on you. We might be doing daily temperature checks. We might be doing daily symptom checks on these individuals. We might actually have a system in place to do random testing for these individuals. Yeah. Because at that point, you are the danger to the group that is vaccinated. Trying to strike a balance. We're not going to let you walk away, and endanger everybody because you feel that, there's something, that is making you stop it. We understand that you have the right, that is your choice, but at this point where people are dying from an airborne disease, you don't want to wear your mask because you feel that you're going to choke. You don't want to get vaccinated because you feel when you get vaccinated, something happens to you. Like, everything you're doing is just not to do what you're asked to do, and then creating, problems for others, So it's just striking that balance. It's really difficult, but this is what we're trained to do. This is what we're trained to anticipate, So we just look for the best ways to work around it.
Right on. So, thank you, Chima.
Yeah, thank you.
You all right, my friend?
Yeah.
Yeah, take a nice big exhale.
Yeah, it's a long day ahead for me, like.
Well, happy belated Father's Day, Chima.
Huh? You say, Jason?
No, happy belated Father's Day.
Oh, thank you, and you too, and Chris.
Thank you, Chima. Oh, there's a smile.
There it is.
Every time I speak with you guys, new things come up. I think our our discussion, like at the beginning, it was very, like everybody was on edge. There was too much fear.
Yeah.
But now I think even everybody gets it, and I think that attack on public health is no more there. There's support. There's better understanding and appreciation of what we've done. Like other countries are actually reducing restrictions, but it's the same way we're doing it. Like it's gradual, it's measured. Nobody wants to take the chance. Of just getting excited and opening up. I think that excitement most times is the problem. Like we're all so safe here. We're about to walk around. Living our normal lives, and then boom, something happens. So for us at Public Health, we are still vigilant. You can see my eyes are still red. There's still lack of sleep. I'm up till 1 a.m. Trying to make sure that things are okay. And while people sleep, we're awake. Trying to make sure that when you wake up, you're safe. So thank you for the support. And the understanding. That we're here to ensure that the island is safe. Thank you.
Thank you, Chima. Appreciate it. Get a power nap in. Art said it's okay.
That my director is a workhorse too.
I know.
He
I know.
gets no sleep.
I'm texting him at 10 at night to get you, so I know he's a workhorse. Now, Chima, I mean, you guys at Public Health, you guys have busted your ass during this pandemic, and I think you deserve a gold medal as an agency because, well, here we are. I mean, here we are. We're here, guys.
A gold medal or a shot of shot of something strong.
A shot of something other than the vaccine.
Yeah.
Thank you, Chima. We'll see you.
Okay.
All right.
Have a good day, Chima.
7:58. Hey,
Okay.
real quick, guys. Sorry, because they went and they came out with this whole Vax and Win promo.
I was just about to say
Which
because
is
my
huge.
DMs have been going crazy.
Right, guys. I'm so sorry, but we knew yesterday